Hello everyone, April here from Pelvic Balance. I want to talk about tight hips today. I see a lot of tight hips in my practice. And did you know that there is a direct connection from the pelvic floor muscles to the hips? So if you have, say, a hip issue, whether it's pain or tightness, it could be related to your pelvic floor muscles. And vice versa, if you have a pelvic floor issue, it may be related to what's happening with your hips. So we have to look at everything together to find out what is causing the issue. So I have a quick little test for you to see how your hip flexibility is. Start by seeing how far can you bring your knee to your chest. You should be able to bring it up pretty close. If you start to lift one knee towards your chest and the opposite leg starts to come off of the table, that indicates there is tightness. Can you cross one leg over the other? And when you do so, is the other side of your pelvis staying flat or is it popping up? That can also indicate tightness. Now, if you found some hip tightness, it can indicate that there is some imbalance somewhere. So maybe your pelvis is sort of stuck, not moving a certain way, or the hip joints are stuck in a certain position. I often find that the hip joint is riding forward in the socket, which is putting pressure on the front of the hip, and therefore that's why someone may feel some tightness there. Whatever it is, we have to figure out what's the cause so that we can get down to the bottom of it and help resolve that issue for you. So if you have more questions about hip tightness or the pelvic floor, feel free to reach out to me, April@pelvicbalance.com. Thank you and have a great day.